Good day, ma'am. I am Dilmar O. Umayan, BPE2, PE5 Local Government Administration. I am here to present the four topics, and the first topic is full devolution to happen with issuance of Executive Order 138, and second topic is Philippine case study, and the third topic is decentralization in the Philippines, and the fourth topic is the local governance survey in the Philippines. Full devolution to happen with the issuance of Executive Order 138. Executive Order 138 signed by President Rodrigo Duterte, the Department of the Interior and Local Government, DILG, the full devolution of the basic services and facilities from the national government to local government units (LGUs) will finally begin the increase of LGUs in all national taxes and revenues. With Executive Order 138, the long series of goal of LGUs to finally implement the full devolution of powers and resources mandated by the 1991 Local Government Code will happen under this administration. Under full devolution, many good things are coming in LGUs. He said, Eduardo Año said, Executive Order will ensure that the policy of decentralization as enshrined in the Constitution and the Local Government Code, as well as the increase in the share in the national taxes for LGUs. We thank President Duterte for staying true his commitment to local autonomy and full devolution through the signing of this executive order. This will start the ball rolling and ensure that LGUs will be ready for bigger responsibilities that come with financial resources. Dahil sa devolution, aangat ang lakas ng lokal sa tulong ng dagdag na pundo na magdudulot ng angat serbisyo para sa mga mamamayan. Because of full devolution, the LGUs would be empowered with more funds that result in improved service to the people. In 1991 Local Government Code mandated the devolution of the basic services to LGUs. This was anchored on the premise that LGU are in a better position to address the needs of their constituents and can therefore deliver better services. However, full devolution was never achieved because the funds necessary to implement full devolution were never fully downloaded to LGUs. The DILG chief said Executive Order is a leap towards the provision of a more responsive and accountable local government structure instituted through a system of decentralization whereby local government units shall be given more powers, authority, responsibilities, and the corresponding financial resources. Philippine case study, 3 decades of devolution, the Philippines, how this has shaped health financing and public financial management. Over the past 5 decades, subnational government units in most countries around the world have assumed some extent of decision-making authority. First, this often occurs through devolution, a reform that typically involves the transfer of different government functions related to sectors such as health from the national government to subnational units. The evolution often entails changes to public financial management, role systems, and processes. Similarly, countries have also initiated health financing reforms such as expanding publicly managed health insurance, eliminating users' fees, and introducing performance-based payments to move closer to the goal of achieving universal health coverage. While national government exercise a high degree of control over the design of health financing reforms, their implementation in the centralized context is heavily influenced by local politics, policies, and processes. Subnational government units in the centralized system are often expected to be accountable in purchasing of primary health care services, exercising considerable control over the funds flowing to the public facilities, including from users' fees or insurance reimbursements. Public funds and its management to take on a crucial role in ensuring sustainable health financing for achieving UHC. Globally, public financing accounted for approximately 60% of health spending in 2017 and increased faster than any other source of health expenditure over the preceding decade. Decentralization in the Philippines. The 1987 Constitution also gave autonomy to local governments, which are composed of three levels. Number 1, provinces and independent component cities, or highly urbanized cities. Number 2, component cities and municipalities. And number 3, barangays or small districts. In 1991, the Local Government Code instituted a system of decentralization where local government units, LGUs, were given more powers, authority, responsibility, and resources, including those for basic services such as health, under Republic Act of the Philippines 1991, although LGUs additionally taxing power because of devolution. These additional sources of funds continue to insufficiently cover the cost of their additional mandates. Over the years, the government has introduced various health system and financing policies, plus initiatives to address the weakness of this current system. This case study aims to provide a current snapshot of the PFM processes in the Philippines. Local Government Survey in the Philippines, Planning and Development, Local Government Officials and Capacity Development Opportunity. Development. The capacity of government officials is key to improving governmental performance at the local level. The Department of Interior and Local Government has published its annual Local Government Performance Management Systems LGMPS report every year since 2009. LGPMS defines the local governance performance using the following 5 categories. Number 1, administrative governance. Number 2, economic governance. Number 3, social governance. Number 4, valuing fundamentals of governance. Number 5, environmental governance. Performance of local government is an integral of overall governance performance. It is important to note to what extent the planning and development coordinator is given the opportunity to develop their capacity. In survey, we asked about the frequency of attending seminars, workshops for capacity development purposes within past year. About 12% of the respondents did not attend any seminar or workshops in the past year while attended one. 15% attended 2 and 62% attended more 2. In total, more than 90% of the respondents attended at least one seminar or workshop in the past year. Thank you, and that's all my report.